Ow. Okay, so I just came home from school. It's like 2, and I feel like most of my videos are just me complaining about, my ex. But there's more important stuff out there, and I always knew there was. And whenever I cry, I always just think something worse could be happening to me. But that doesn't really help in the moment because this, whatever it is you're going through, is the worst thing that could be happening for you. You know what I'm saying? But I just want to take this time to talk about cancer. Because I know a lot of people have parents, siblings, relatives, close friends that have cancer. When you think of the word cancer, I feel like if you're kind of, I don't want to say ignorant, but you don't have all the knowledge about cancer. Someone says cancer, you think of lung cancer, and you think of, elderly people having cancer. And that's not always the case. My sister, who is 21 now, she had cancer when she was 14. Well, it started when she was 13 or 12. And, no, I lied. The cancer started developing when she was 10. The cancer she had was a brain tumor. It was called germinoma. And what it is, it's a brain tumor that's in, I forgot. I always like saying that word. It's in the pituitary gland, and it stunted her growth and made her develop very late. So she, even though she was a 14-year-old girl, she still had the body of a 10-year-old. Like, this is really awkward, but I feel like you guys should know. She didn't get her period until she was 16, because of the hormones that they gave her, which I'm going to talk to. But okay, so she was 14 and she didn't have any hairs. She didn't have breasts, and she didn't get her period yet. She had these really bad migraines, and she would have to come home from school sometimes, or stay home from school because they were so bad. And we're about 6 years apart, so I was around 8 when they discovered it. And I remember my mom trying, because my mom knew there was something wrong, because like a 10-year-old shouldn't be having this much headaches. So she kept on going to doctors and stuff to find what was wrong with her. And finally, my primary doctor now, Dr. Festa, he referred my sister to Dr. Wilson, who discovered that she had diabetes insipidus, which is when you drink an excessive amount of water and you pee every 15 minutes after you drink. And my sister could drink gallons and gallons and gallons of water within a very short amount of time. And he referred to her to Dr. Eggman, I want to say. Yeah, Eggman. Eggman's my gym teacher. I forgot his name. But he was a head specialist, and he did some MRIs, he did a bunch of tests. A week later, he calls us in for the results. And he asked my mom if she wanted me to hear the results, and my mom said yes. We're a family. My daughter's part of the family. She should know. And I remember we were in this tan beige room, and there was the examining bed. My sister was sitting on it. I was sitting next to my sister. My mom was standing up, laying against the wall next to my sister. He comes in with the results, and he said that my sister had cancer. And he explained to us what it was, and I remember, I was 8, but I just remember the devastation on my mom's face. I see it, because I just know her, and I feel like my sister saw it too, and it was more determination than anything to be like, alright, like, you know, get this motherfucker out of her brain and make her healthy. And then we did, I think, 14 cycles of chemotherapy for about 6 months. And I just remember my sister had this long brown hair, like up to, like down her back, like all the way up to her butt. And I remember that was the hardest thing for her. And I remember she went to the bathroom, and when she left, I just saw this wall of hair on the floor. And I didn't say anything. And then about 2 days later, she was combing her hair, and just locks of it came out. And I just remember she just started breaking down, because it's like hard for you. And even though it's just hair, it's like, I don't know, it's like an identity crisis, I guess. And I remember she got up to like 70 pounds. She went from 120 to 70 pounds within like 2 months. And her survival rates were low. And it was like a 10 or 50% chance. And I remember my dad changed. My dad is an amazing man now. He's there. He's a family man. But back then, we were already having family issues with my dad back then. Because he just wasn't a good father and husband at that time. So instead of him being there with my sister or like taking care of me, because I'm only 8, he would leave me home, and my mom, like, I would miss so much school because I would be sleeping in the hospital with my mom. And I didn't know what cancer was. And now it's hitting me that my sister, well, it hit me when I found out what cancer was, and like when I was like 13, when I actually like had a full knowledge of cancer, my sister could have died. And that hurts so bad. Like, I don't know. And I'm sorry this video is really long, but then she basically she was weird, and she wore hats all the time. And I remember when her chemo was done, her hair started growing back, and she had like peach fuzz, and she was so proud of her hair. And looking at like pictures now, you're just like, what? Like, we thought it was so long back then. They gave her hormone shots to develop anything, and now she has boobs, and she got her period and stuff. But it was just really hard for my family. And my friend Sarah, her brother has cancer now. Oh, okay. Well, he has cancer now, and he's only 22 months. That's crazy. He has lung cancer, and because how can a baby that small, like, he has, I think, a 20 to 30% chance of surviving. And honestly, like anyone going through this, the only thing I can advise you is just stay strong. Like they'll make it through it. I honestly can tell you, it's a lot easier on yourself if you hold on to that, like whatever percent chance you have of survival. Just hold on to it, because there's still a chance. I mean, whoever is diagnosed with cancer is filled with hope and faith, and honestly, you just have to like let it take its course. Like, be on point with what the doctors are doing, because my sister almost died of an overdose. Because my mom left her for about an hour to take me to the doctors, and they almost killed her with an overdose. So make sure you're on point with what the doctors are doing. Don't be afraid to ask questions, because you're you're either the patient or the patient's, like, sibling, parent, close friend. Well, I don't think close friends can do that, like, in the hospital. It takes a lot. I don't know. Like, so be on point with what they're doing. Ask questions. Be there for them. Talk to them. Don't act like they have cancer. Don't treat them differently, like, because they have cancer. Don't, like, talk to them how you would usually talk to them. And that's all I can really say. If you're a sibling of someone who has cancer, help your parents out. Like, clean the house, cook dinner. That's all I can basically say. And my sister is, let's see. She's 6 years clean, and the 5-year mark is that there's a very, very low chance of it returning, so I'm so happy for her. I'm happy for my mom too, and just, it's great. And I hope my story helped you guys.